Hi there. Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue to discuss the COVID-19 pandemic. It is here for real in Guyana. We've had over 300 people dying from it. That's 300 families that have been put in mourning from the COVID-19. And we continue to hope and pray, and we continue to practice the safe measures that are recommended in order to beat and combat this deadly pandemic. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. I'm wearing my mask today in the correct way to cover both nose and mouth. It is not always comfortable to do so, but it is absolutely necessary to do so. I will take it off now so we continue our conversations, and I do so by using the straps around my ears. COVID-19 has been with us in Guyana since March 2020. We have had 300 persons unfortunately dying from this deadly pandemic. But Guyana is no different from the rest of the world. Across the globe, we have seen significant number of persons infected with COVID-19. In fact, now, as we are speaking in the first part of May 2021, there has been about 153 million people across the globe. That's 153 million people across the world that have been infected with COVID-19. Of these people, there are 3.2 million deaths so far recorded as of May 2021. It means, therefore, that across the world, the case fatality rate is about 2.1%. That's the number of deaths over the number of total positive cases. It's 2.1%. And this is quite in keeping with the earlier recognition that across the world, the death rate is about 2 to 3%. It varies from place to place depending on several factors, but generally across continents, it doesn't matter where you are, whether it's Africa or Australia, Europe, North or South America, the death rate is between 2 to 3%. And it doesn't matter what type of treatment is given to these patients, it remains the same death rate, 2 to 3% across the globe. So our best chance of beating this is thought to be a vaccination program. And this is what we have embarked on in Guyana since earlier this year in March 2021. In Guyana right now, first week of May 2021, we have had over 13,000 cases of COVID-19 positive patients in this country. That's 13,000. Right now, the number of cases or number of persons being tested daily is returning a positive ratio of between 7 to 10%. So if we do a number of tests, for example, if we were to do 1,000 tests, we would have between 70 to 100 persons being positive. So that's where we are, 7 to 10% positivity ratio of number of tests. We have passed the 300 mark. By the time when I was preparing this presentation for you, we were at 299. But unfortunately, we have gone past the 300 mark at this moment. And our case fatality rate in Guyana is 2.2%, which is quite in keeping with what prevails across the globe. And like I said, it is not better or worse than anywhere else. It is in keeping with what is happening all across the globe. We see in our evaluation of what's happening in Guyana that there's been a sharp increase in the number of active cases that really started in March of 2021. The graph shows a rapid increase and doubling of cases for March and April, and we're still having a significant number of positive and active cases in Guyana in the first week of May 2021. This is not anything, that we could not predict, because we know as pandemics go, all the pandemics that we would have experienced in the world, if one would have been reading the historical perspective, these pandemics, especially infectious pandemics, they come in waves. So we had a first wave, and now it seems like we're in a very bad second wave. Guyana is not unique. The same thing has happened in Brazil, the same thing has happened in the US, but it is important for us to recognize that these things come in waves, and we're in the midst of something really serious at the moment. Knowing that, we can now tailor our behavior and continue to practice the safe things that we've been advised to do from day one. That is social distancing, wearing of masks, and sanitization as often as possible. If we were to look at our brothers and sisters across the ocean in Trinidad and Tobago, we have seen, and what we know is that Trinidad has been in a lockdown for more than a year. But despite being in a lockdown, they still recorded over 11,000 cases. 11,000 cases in a country that has been in lockdown for more than a year. And in fact, I believe from today, they are going to implement almost a martial law type of scenario in Trinidad. Our friends in Trinidad have had an unfortunate number of deaths as well, over 170 persons who would have died from COVID-19 there. And again, if you look at the graph for positive cases, the same thing basically that happened in Guyana is the same thing has happened in Trinidad. A sharp spike in the number of cases that started in March of 2021. A very sharp spike, and I suspect that it's going to go up until they get to a peak and it comes down again. And this is the second wave that is touching our friends over in Trinidad, just the same way that it did, or it's doing, in Guyana here. They have taken some measures, and I believe there's a lot that we can cooperate on, a lot that we can learn from each other. They have put in place some measures a couple of days ago to help and stem the tide of this rapid rise. For example, they would have extended some curfews. As of midnight, all restaurants and bars will be closed. You know that in Guyana, our curfew starts at 10 o'clock or thereabouts in the night, and it extends to about 5:30 in the morning. Trinidad has closed all malls. All places of worship will be closed. All gyms, fitness centers will be closed. All spa and beauty dispensing areas closed. Casinos, cinemas, theaters, clubs are all closed. Public service will operate on an essential service only. And all tours to various areas of recreation will end. Now, I have a particular concern when we talk about essential services, because I believe that the society functions best when everyone does their part. We think of essential services, let's say a doctor, for example. But in order for that doctor to get to work and that nurse to get to work, their homes have to be taken care of. And in this time when there's no school, for example, doctors, nurses, healthcare professionals who have children have to ensure that their children are taken care of before they leave their homes. That's your primary responsibility to your family. Now, if you do not have grandmothers, aunts, uncles, etc. to take care of your children, then some people are fortunate to have babysitters, etc. So it means now that the babysitters become part of an essential service, because without them taking care of the children of healthcare workers, the healthcare workers cannot turn up to work. The way that healthcare workers get to their place of work is by transportation, some private, some public. So then the people who are driving the transportation, the bus drivers, the car drivers, they then become essential unless transportation is provided for these categories of workers. So it is important to recognize that essential workers just does not mean doctors wearing stethoscopes and nurses wearing scrubs and uniforms. It is all of the people and all of the services that are involved in getting these people, getting us from home to work in a manner that you can focus on your job and do it. Because it's impossible to focus on your job if you're not sure what's happening to your children and your family at home. That's just human nature. So when we talk about essential workers, it has to involve more than just the doctors, the nurses, the policemen, the soldiers, etc. Everyone has to do their parts to make sure that we get through this pandemic. So we look at another Caribbean territory, and we look at a big population in Jamaica, almost 3 million people. And Jamaica was a great example in the early days. We looked towards them. In fact, I have a lot of friends and colleagues there that when we were faced with our own COVID-19 situation, my friends and colleagues were more than willing and very, very happy to share their knowledge, their expertise. They sent down by electronic format all of their protocols, their treatment strategies, whatever they were planning to do. They were very generous in sharing that, and it demonstrated clearly that there is need for cooperation at all levels in our region. So in Jamaica, with 3 million people general population, they have had 45,000 cases of positive COVID-19 patients. That's 45,000 people. And they would have had, unfortunately, 784 people dying. This is a couple days ago. 784 people dying. And that's 784 families in mourning as well. They've had 21,000 people recovered. And generally, because of the size of the population in Jamaica, they're usually, these last couple of weeks, they've been having more than 150 COVID-19 patients in hospital at any one time. There was a time when they were running out of beds or close to maximum use of beds, and we're very happy that that is no longer the situation with our brothers and sisters in Jamaica. We continue to wish the entire region well as we battle along this. Again, if you look at the curve with the number of positive cases or active cases in Jamaica, it is almost identical to what we're seeing in Guyana, what we're seeing in Trinidad, and that is a sharp spike starting in February in Jamaica. They seem to have hit a plateau in the latter part of April 2021, and hopefully that graph now starts to go down dramatically to show that they are having less and less positive active cases in the community. So in order to beat this COVID-19 pandemic, in order to beat it locally and regionally, we all have to share information, we all have to practice the same safety guidelines, because it affects us all despite resources, despite our treatment strategies, etc. All of us seem to be experiencing the same second wave around the same time. And we've all experienced spikes in positive cases, spikes in death rates. I hope this would have helped to share some knowledge about what's happening not just in Guyana but around our region as well. And remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me.